Hello, and welcome to this session of Meet the Doctor. My name is Dr. Michael Badanek. I practice in Ocala, Florida. I am a licensed healthcare provider, and we utilize functional integrative medicine at our office. I've been in private practice here in Ocala, Florida from 1981 to the present, so that's roughly 36 and a half years. Today we're going to be speaking upon autoimmune diseases, a very, very important topic to which is underplayed today by traditional mainstream medicine. It is noted that there is between 200 and 206 autoimmune diseases that plague the body. So before we get started, let's try to discuss a little bit of the history. What is autoimmune disease? The autoimmune disease is primarily a condition where the body starts building up resistance and antibodies against certain tissues of the body. These particular tissues have had an exposure to abnormal reactive components such as particular forms of proteins or inflammatory agents, which have now caused a reaction to occur where the body is producing an antibody against that particular organ to destroy it, as though it's a foreign entity. Some examples of autoimmune disease are rheumatoid arthritis, scleroderma, lupus, multiple sclerosis, Guillain-Barré syndrome, Parkinson's disease. Also, things such as Crohn's disease, hepatitis of the pancreas or pancreatic hepatitis, and many, many other diseases that have been identified, which now are causing disarray and issue with the American public. People today are keenly aware that our country is becoming more and more plagued with sickness and disease. Of the top 37 industrialized countries in the world, we're ranked number 37th as overall health care and well-being of our people. Yet America spends more money than all countries combined in service of health conditions and services. We are ranked number one in one thing, however, and that is infantile mortality in the first year of life. So in essence, there is a great cry of the American public to wanting high quality health care, to which is not currently being given to people due to the factor of traditional medical means. So let's discuss this situation of how autoimmune disease occurs. One of the major conditions that cause autoimmune disease is abnormal gut permeability. And what I mean by that is that in our gut, which is a long tube from the mouth to your anus, in the digestive area of the small and large intestine, particularly the small intestine, there are villi. So this long tube, which allows us to absorb fats, proteins, sugars, substrates, vitamins, minerals, etc., have these finger-like projection called villi on each side, the upper and lower portion of the actual tube itself. Now these villi have specific ranges of diameter of space in between these villi, to which if these gaps or spaces increase in size, then abnormal proteins that the body cannot break down or absorb, such as gluten and casein and other types of substrates, will then permeate and go through this lining, going into the bloodstream, and then affecting different organs of the body. So what we typically see is that when people have been on long-term use of medications or alcohol, antibiotics, and so on and so forth, or they have sensitivities to certain foods such as gluten or casein, a particular product in the gut called histamine will start to increase in its predominance. Histamine then goes and causes these gap junctions in the villi to increase in diameter due to secreting a product called zonulin. Zonulin is controlled by a product called diamine oxidase, which blocks histamine from the conversion of histamine to increasing the zonulin levels. So if you have an elevated level of histamine in your body and you're weak in a product to help degrade the histamine called diamine oxidase, you will have this zonulin increase in permeability, thus allowing abnormal proteins to permeate in through the gut, disseminating through the body. These abnormal proteins will then go and to attach to certain organs. The body will say this is now a foreign object. It will then develop an antibody against it, and that's the beginning of your autoimmune reaction. We also have a gut-brain barrier, a blood-brain barrier, which is a very tight sieve also, to which when you have autoimmune disease or abnormal histamine levels and such, you will then open this level of the brain to allow abnormal proteins to come in through there, thus setting you up for your autoimmune diseases of the brain. So with that in mind, it is critically important when you treat autoimmune disease not to suppress the symptoms with corticosteroids, which is classic in traditional medicine, but it's important to understand what's causing it. Remember, all death and disease begins in the gut. And when you can identify these issues, then you can then successfully evaluate and treat these conditions to help reduce the ability of the body to be destroyed with these autoimmune reactions. At our office, we deal with functional integrative medicine to go and to address these particular issues so that you, the patient, will have knowledge, because knowledge is power, and to be able to help you treat the condition. Remember, treating symptoms does not evaluate and successfully treat the cause and or the disease itself. If you'd like further information, we offer a courtesy consultation on this particular episode and or any other types of health challenges that may affect you or your family members. Please contact our office at area code 352-622-1151. That's 352-622-1151. Or go to my website at drbadanek.com. That's drbadanek.com. We look forward to treating you and helping you with your health challenges. Have a good day.